The ambiguities that pervade the clinical situation are so profound. It opens up the door for insurance companies to step in and say, well, you don't have an outcome measure. You don't have a way to substantiate that the patient is better, worse, same. So we will do it for you. You know what I would love? What if insurance companies were consultants? What if doctors and patients who were working hard in a treatment scenario, but maybe not getting where they need to be, what if they could turn to the insurance company and say, you know, we're kind of lost here. X and such patient's been coming to see me for a year and a half, and the depressive symptoms have continued. I've used X, Y, and Z strategies. What do you guys suggest? You're paying for this anyway. What if you could invert the paradigm a little bit so that the insurance companies weren't the dark force that was controlling and ultimately degrading health care experiences for patients and doctors, but rather supporting it? I think it would be a simple paradigm shift where they could start viewing doctors and patients not as enemies that they have to either refuse care to or control, but rather as the most sacred dyad in the recovery process. And how can I help you guys? Why isn't there a mechanism within an insurance company panel to have a psychotherapy consultation where experts in the field are able to weigh in on the progress of a psychotherapy, either with the patient and the therapist together, or just for the patient or just for the therapist? To me, that would be a beautiful way to actually profit from the fact that the common denominator that we all have is insurance.
I mean, the thing is, they'd have to be super educated.
But they could. What would stop them? How?
Yeah.
They hire me. Be like, okay, so for all the patients that have borderline personality disorder, like you're kind of like overseeing the borderline division. And, you know, when there's an adverse outcome or someone gets hospitalized, it would trigger me to like get involved and be like, get on the phone with the psychiatrist and the therapist and be like, what's going on in the treatment? Are we doing DBT? Are we trying a mood stabilizer? Are we, you know, doing this, that, and the other thing? But not in a way that was like punitive and angry and bad doctor, make bad decisions, but rather like, whoa, tough situation. How can we collaborate? How can we work together?